Okay, I'd like to go through the Adrian with you. Adrian's a patient that came to see me. He had a trauma of his teeth. So when you have trauma of the teeth, a lot of the times teeth die. When a tooth dies, usually the first thing that happens is it goes black. Being a back tooth is not so much an issue, but when it's a front tooth and when you're a young man like Adrian, problem is everyone sees the black tooth. So what we're doing here is you want to remove the black tooth, but the other problem he has was a space between his teeth. Gaps between the teeth tend to draw the eye straight to the space. So we've now got two problems. We've got the problem of a dark tooth right at the front, and we've also got a problem of the space basically between the teeth. If we go to close up here of Adrian's mouth, first thing you'll notice of course is the gap. You notice that the teeth are irregular, black tooth at the front where we've got half the tooth missing because of the accident, and we've got cracks running down the other teeth. One of the things when closing spaces is that if you make the two teeth larger to fill the space, is that the two front teeth look too big. So we always got to look at golden proportions and use maths in order to determine proportionally how big should the front teeth be to be in harmony with the rest of the mouth. So in Adrian's case, what we worked out is when we started to do the maths, we had to actually work on 4 teeth, because if we make the lateral teeth slightly larger, it means that we can make the central teeth a bit larger, and therefore the harmony and the proportions of the teeth all blend in. So I'll go to the next photo, which will actually show you the cracks. So this is when we're shining a blue light at the back, and you can see almost like a star fracture that's gone through that front tooth. So there's a lot of weakness within this tooth. Again, dead teeth not only are dark, but because they're dark, they are more brittle. And we find that brittle teeth, if a tooth's going to break in your mouth, it's usually a dead tooth or a brittle tooth that actually goes first. So in Adrian's case, we're making sure that, of course, that he's going to look beautiful and nice and handsome, but we're also going to make sure that the teeth are going to be strong and going to last a long time. Okay, so in this case now what we've done is we've actually asked Adrian about the shape of his teeth. We've got a lot of feedback from him, and by doing the front teeth, what the technician has done is he has waxed up, or he's done a diagnostic wax up or mock up of what the result's going to be like. So here what we're seeing is we're seeing the 4 teeth have been waxed up, the proportions are nice, they all reflect and are in proportion to each other. So we've now got the balance back within these front teeth. From here, Adrian's had the teeth actually whitened, so you can see the old filling remains about the same colour, but you can see how nice and white these teeth are. So after the whitening's actually been done, we're now ready to go forward and start doing the cosmetic treatment. So on the day of getting the treatment done, we prepare the teeth, and we're really getting the surface of the teeth prepared so that it can take the porcelain veneers, and we put temporaries over the top of the teeth. Again, we're looking at the temporaries and making sure that Adrian's happy with these temporary teeth. He's using them, he's smiling with them, he's talking with them, showing them to his friends, showing them to his girlfriend, and he's really asking them whether they look right, but also to him, are they in harmony with the rest of his teeth? And when he smiles, does it look natural? It's really important that things look natural. We've now finished the case, and we've actually put the porcelain teeth in, and you know we only did the 4 front teeth. So one of the things that we always look at is we want to look at, do the back teeth and the front teeth actually match up with each other. So in this case here, what we're really looking at is, do the back teeth and the canine teeth and premolars actually blend into the 4 front teeth and look natural. And in this case, with the whitening, with the fact that we close the space by actually working on more than just the 2 front teeth, by the fact that we've also made sure that the gums and the position of the gums are the same, the harmony is placed back into the smile, and we can see some of these final photos here of him smiling, that he's a very happy patient.